Hey guys, it's Coach Carrie, and today we're going to be talking about inflammation. It's one of those things that we all have to deal with. I know 9 years ago, before I started my health journey, I was really dealing with a lot of joint pain. So I have 3 kids, and at the time, my youngest, Carter, was 3 years old, and I literally would not pick up that child unless I was right by the sofa because I was always scared that I would drop him. Now, he was a little chunky monkey, is what I used to call him. He was heavy. But it was just the fact that I was 37 years old and I had absolute pain in both of my wrists and also in my ankles. So I would be fine during the day, but once the evening time would come, I could not walk across my den floor with one ouch, 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 plantar fasciitis, a lot of those things. Well, that's all inflammation within your body. What I found out after I changed my diet and I started taking the proper supplements is that it allowed my body to heal. Within 3 weeks, I was starting to feel better. Within 3 weeks, it was one of those things I wasn't looking for, but it was something that I woke up and I was like, my wrists are moving now, and I haven't taken Tylenol in the last few days, and it was one of those aha moments. So before I started my health journey, I was getting a lot of sugar. And when I say a lot, I mean a lot. And actually, if you're not on a health journey, you probably are too. So typically at 6:30 in the morning, by the time I ate 2 bowls of cereal and had my milk on top of it and had a glass of orange juice because I had a vitamin D deficiency and I thought those would be things that, would increase my vitamin D because that's what the container said. Those were the things that I was doing, but I was typically getting about 100 grams of sugar by 6:30 in the morning, okay? Now don't judge me because I was going to the Y. I thought I was going to go work it off. Isn't that what we all do? But we really do need to change our diet. We need to get out the sugar. We try to limit our dairy intake. There's a lot of things that you can do to actually help with your inflammation. Getting gluten out of your diet, that's another big deal. Those are things that can be triggers for a lot of people in their inflammation. So I thought I would take you along to meet my chiropractor, Dr. Kris. He's in Thomasville, North Carolina. And in the last several years, if I have an ailment, a pain that comes up in my shoulder or a hip or whatever, I'll go see Dr. Kris because I know he's not just going to put a Band-Aid on top of the problem. He always gets down to the source, and I really appreciate that. So on my interview with Dr. Kris, I learned a lot today. So we talked about inflammation, some of the causes of it, some proper supplements that you can actually take to help with your inflammation levels. We talked about different skin ailments, things that you can add to your foods. Maybe you're struggling with being able to release weight and you're not cheating and you can't figure out why. Like, what are you doing wrong? It's probably not anything that you're doing wrong. It's just going to be a healing process. So we're going to go see Dr. Kris today. He's going to talk to us about all these different things, and I guarantee you, you're going to learn something just like I did. All right, guys, join me on our journey. Hey guys, it's Coach Carrie, and I have Dr. Kris, and he is my favorite chiropractor, actually my only chiropractor. And normally when I come in here, you normally tell me I'll see you in 6 months, typically.
That's right.
Yep. So he's fixed a lot of ailments. I remember the first time that I met you, I actually was having problems with my shoulder. I was having so much pain that I couldn't even put on deodorant, that movement there. And I think I've been coming to you ever since. So introduce yourself, tell us where you're at, because I'm sure we've got people who want to actually come see you for their ailments.
Well, I'm in Thomasville beside the
Planet
Food Line
Fitness.
and the Planet Fitness. I've been here for 23 years, which is unbelievable now. But and I've been treating headaches, back pain, and typical chiropractic things for 25 years almost. And so one thing I do want to say is there's been a lot of overlap with my patients and your clients. And so one thing I do want to give you kudos for is that I have preached proper diet and anti-inflammatory diet for years, and I've not broke through like you guys have. So you've done very, very well. And I have a lot of patients that I've actually seen transform their bodies actually after going through your program. So good job.
So that's what I kind of wanted to talk to you about today. So just a couple hours before we even started meeting, I just put out a poll on Facebook and I said, does anyone out here deal with inflammation? And so far, every single answer has been yes. So it's obviously a question that we all deal with. Okay, so I wanted to talk to you about inflammation, kind of tell us what it is, some natural remedies that we can share to help with that, and
Sure.
your wisdom.
So inflammation obviously is a broad spectrum problem, and it drives a lot of patients to come in to see me, and they ask me, why am I hurting? And usually they're inflamed for some reason. So I always tell them it's either a physical injury, which, like a car accident or falls. It can be emotional stress, which if you're like a death of a loved one, of course that throws your internal chemistry off and can be pro-inflammatory. And then chemical stress, which is your purview, which is mostly diet, but it's also supplementation. And so people who have physical injuries that can respond to chiropractic care, if they have a lot of chemical stress, it takes a lot longer for them to respond, because that chemical is like throwing fuel on the fire. And so one thing I like to tell people too, if they're noticing you're having joint pain and back pain and headaches and skin issues, and this is your body's check engine light coming on. And so these things are life affecting, and then typically what we do is we go to the doctor and we get medications which cover up these symptoms.
Right. It's like a Band-Aid.
That's a Band-Aid. It's not fixing what's driving the problem in the first place. Right. And so if you have these pro-inflammatory conditions, you really need to figure out what it is, and we'll discuss that a little bit. But and if you can drive it, instead of just taking the medication, which is like taking the fuse out of the check engine, and, it makes you feel better, it's not fixing the problem. And what can unfortunately happen is down the line, it can become not only a life-affecting, but a life-threatening problem, meaning heart attack and stroke, and whatnot. So if you're having inflammatory conditions, you really need to get to the root cause, in my opinion. That's what chiropractic's about too, is getting to the root cause of the physical problem, where you're getting to the root cause of the chemical problem, and they really do go hand in hand.
Yeah.
So oftentimes the one thing that people could take away if they're having physical pain is, I always say ice to decrease the inflammation, and everybody goes to heat, and heat is for,
because heat feels good.
Yeah, it's relaxing the muscles, but it's driving up the inflammation. And so when they go to the medical doctor to put the Band-Aid on, they take the anti-inflammatory medication. And oftentimes, doctors and physicians will say use the heat because it does relax the muscle, which is part of the pain. But they're saying use the heat and take this anti-inflammatory. And I always say that's like putting a humidifier and a dehumidifier in the same room and letting them fight it out. You're not, so use the ice to minimize the amount of the inflammation on these particular areas, and that's 20 minutes at a time. Okay. Now, in terms of, this is a broad scope topic, and there's a lot of different things that can drive inflammation, but things that can really affect absolutely everybody is diet, which is decreasing the sugars is the number one way to in diet-wise, to bring down your inflammation. And so I have a friend who's a functional medicine doctor, and he looks at four main things. And one thing is essential fatty acids, which is fish oils, which is the thing that I want absolutely everybody to take. I'm going all over the place, but I have a daughter who's 15 years old, and for people that are maybe watching this, come to see in my office for that long, she used to come here on Fridays, and Rosanna, my office manager, would actually watch her, and we actually put fish oils in her formula because
Yum.
And it stunk, but she didn't know any better. She did. So if you have you actually, so breast milk is better, but if you can't have breast milk and you have formula,
right?
If you see on the cans, it actually has EPA and or specifically DHA on the cans because it's so important. The problem is when you open up those powders, that oxidizes and you lose it. So you're not getting anywhere near the amount. So I literally took a capsule and squished it, an appropriate amount for an infant,
right,
into her bottle, and she had that. So she's been out on fish oils her entire life.
Oh, good.
Yeah, it's extremely important. So I want to talk more about that. So we're going to get into that. Vitamin D is the other supplement that I think absolutely everybody should be taking, and I want to give a little anecdote about that. My wife was having health problems 2 or 3 years ago, things that are just symptomatic, but it was the check engine thing. And so I did some blood work, and on a whim, at the very end, I said, well, let's just check her vitamin D. Now, the reason why it was a whim is because she lays out in the sun for and this is in the summer at the time, and she lays out in the sun for 15 minutes for health reasons, because of course, when you're exposed to the sun, you create vitamin D.
Right.
So I did not think it was going to be a problem at all. She was rock bottom low, which this is right at the beginning of COVID, which we were already learning, by the way. COVID, one of the main predictors in survivability of COVID is high levels of vitamin D, by the way, because it helps you fight infection. So I sort of freaked out. And I've been taking 4,000 IUs of vitamin D every single day, which is 10 times the 400 what they sort of recommend. But the CDC says you can take 4,000 forever without having toxic
without
effects.
any issues. And that's one of the questions I get. Can I take too much of these?
Well, so vitamin D you can, because it's what's called fat soluble, which means it stores in your body, and so you can take too much. And so a lot of these supplements, you got to be a little bit careful when you're getting them from multiple sources, and so you got to add them all up and make sure that you're not going over the toxin. But it's you could short term, you have to take an awful lot of vitamin D to get too much.
And you're not getting these vitamins and minerals in our foods like we were 150 years ago.
And that, like the fish oils, that's the one thing that, so it is not in our foods anymore. It's like unless you're supplementing, you're in a woefully low amount. And so the one thing that I want to talk about fish oils specifically, actually. So fish oils are omega-3s, they're essential fats. And when our body breaks down these fats, it breaks down the chemicals that thin the blood, are anti-inflammatory, and they decrease pain. So we also have these essential fats called omega-6s, which we have to have because when you break down those chemicals, it turns into chemicals that increase pain, which we need to have pain to tell something's wrong.
Right.
Increase inflammation to help with certain healing, but also increase clotting. Because if we didn't clot, we wouldn't be able to heal like we're supposed to. So you should have a 1-to-1 balance. The problem is the omega-6 fats are inexpensive, and so they're in all the foods that we eat, because these companies that are producing and packaging foods for us are using the cheap fats.
Right.
And so we have, and they say any more than a 3-to-1 ratio of the omega-6s to the omega-3s, and you're going to cascade down the inflammatory pathway, and you're going to have aches and pains and inflammatory conditions. And then what you're going to do is take a medication that's an anti-inflammatory, which you may have heard the term, it's a COX-2 inhibitor. It's an enzyme that your body uses to create those pro-inflammatory chemicals, and so it just stops that from happening. Where I suggest you load your body up with the counterbalancing omega-3s, so you do not have to take the anti-inflammatory medications. It's very, very important.
Yeah.
And so, which I just realized too, I didn't realize that you're preaching on anti-dairy and anti.
So we allow 1 ounce of dairy per day on the program, just because we're taking away so many other things. Like we take away their alcohol and everything else. So we're like, okay, you can have string cheese, that's about it. But we always let people know that they will be more successful if they completely eliminate all dairy.
So one of the things that can is an inflammatory condition. Let me talk about the 4 from my friends. So it's essential fats, which is we just talked about. It's hormones, which sugar can mess it up, and so and stress. But it's detoxification, which is your liver and your kidneys, and so the more garbage that we eat that has pesticides and everything else, it just kind of overwhelms that system. But it's gut health. Gut health is extremely important, and 1 in 3 people are walking around with what's called leaky gut, and leaky gut is when you have sensitivities to certain foods. The number 1 sensitivity, well, the number 1 and 2 is gluten and dairy, and so I wanted to share an anecdote from a good friend of mine who's a functional medicine doctor, and so he had a patient who had a classic inflammatory condition that he could treat, and she had headaches, she had fatigue, she had mental concentration difficulties. Sometimes they call it fibro fog, and she had eczema and skin rashes.
Right.
She had IBS type symptoms, so constipation, diarrhea, and pain.
Right. Sounds like our people.
Man, it's almost everybody, but so these are broad scale, but she also had a difficulty losing weight. So he put her on a very strict diet. Now, this is an outlier. Most people respond pretty quickly, but she did this very, very strict and stuck with it, he says, for 6 months. And so he first did the blood work, and she was outrageously pro-inflammatory. So at the 6-month mark, she hadn't felt any better. She had not lost a single pound.
And that was on a strict diet?
On a very, very strict diet.
Okay. At
the 6-month mark, he redid the blood work. Now, she was way out of whack. Right. And at the 6-month mark, she was just still out of whack, but not considerably better. And so he basically said, if you continue, I don't know how long it's going to be, but don't give up yet. You could be so close. So he just encouraged her to continue. Now, I know I never would have been able to keep anybody on, but he did. And he says at the 7.5 month mark, she woke up and felt great.
Right.
And then said, oh, this is good. This is unusual. She continued to feel great at that point. Not a change in her diet from day 1 to 7.5 months. And at that point, she started losing 2.5 pounds a week. And she got down to a size 4.
Wow.
Is that not unbelievable?
That is crazy.
And so for her, it was a gut issue, and it's a little bit complicated, but diet, dairy and gluten were involved.
Okay.
And so basically, she had to heal her body first and decrease the inflammation, and then.
So it basically took 7 months for her to heal her body, her gut.
Yeah.
And then go from there.
And then she did incredible after that.
So I appreciate you saying that, because a lot of times, especially our women, but we always say the women are like crock pots and the men are like microwaves.
Yeah.
Like the men are a whole lot quicker than the women when they're trying to release weight.
Men stop drinking soft drinks and they lose 10 pounds.
Yes, just with the blink of an eye. And the women get mad at them.
Every time.
but a lot of times we'll have people, they're like, I'm doing everything that you tell us to do, and I'm not releasing the weight. So just the fact that you said that, like,
don't give up.
Time.
It does. You didn't get that way overnight, and so
you have to be committed.
You have to be consistent. And so he gave the 9-month mark for like 99% of the people.
Really?
Like for gut issues in particular. But that, so if you were very rigid, so yeah.
Right. Now, so what happens if one of these people like have a cheat day? Does that mess them up? I mean, we always talk about how, like, if you have a cheat day, it delays your fat release by 3 days because your blood sugar is not balanced anymore.
Well, it depends on what the problem is. So if it's a gut issue and you do have like full-blown leaky gut, like I said, this is kind of this is like too complicated. So, but if you did, well, let's talk about it. So if you have a sensitivity to dairy, for example, when we eat dairy and we break it down, it goes into our intestines, small pieces of that protein will go absorb through, and we'll use it as energy. If you have what's called leaky gut, you get these huge gaps in what are called the microvilli of your intestine, and these huge pieces of protein leak through. Now, normally that's not a big deal. What happens is, but your immune system doesn't recognize this large protein. It's not supposed to be there.
Right.
So it does what it's supposed to do and says, okay, this could be COVID or something. Let's create an antibody. Now the problem is, if this protein that comes from food looks like some part of your body, whether it's your skin, whether it's your thyroid, whether it's your nerves, you've created an antibody that now starts attacking you.
Right.
And so medically, the way that we treat it, they say, well, your immune system is overactive. And so we're going to give you a drug which knocks down your immune response, which lowers your symptoms. But now you can't fight off COVID or pneumonia or the flu. And so there's a consequence to taking that drug. But the problem is you need to heal your gut. So in the case of people who have severe leaky gut, if it was dairy and gluten, which again are the #1 offenders, if you went 3 months, I'll give you myself. So I actually went and checked. So my father had Parkinson's. I lost him a few years ago, and his dad had Parkinson's. So obviously I'm genetically predispositioned to have Parkinson's. One of the mechanisms is this, where you actually develop antibodies that attack that certain area of your brain called the substantia nigra. So I didn't want to wait around until I started having symptoms. It's first diagnosed when 80% of that brain has already been destroyed. So I wanted to be proactive as opposed to reactive. So I did the blood work, and sure enough, I'm like 1 in 3 people, and I have leaky gut, or had leaky gut, and it was dairy and gluten were the two for me. Okay. So I went all out, 0 gluten, 0 dairy. Now, at the 3-month mark, I was making myself a roast in a crock pot. Now that you mentioned a crock pot. And I wanted to thicken, my gravy, and I did everything absolutely right. I didn't use flour, I used like this arrowroot anyway, and I did everything perfectly. But I put some red wine in just, for flavor. Well, I ate this and I had a terrible response. And so now, prior to me going on this diet, I've been eating gluten without any issues. But I went 3 months without gluten, and a little tiny bit slipped past the goalie. What it was is there's gluten in wine, in most wines, because they line the barrel on what's called gliadin, which has gluten in it. So this little bit of gluten caused me to have, my wife kicked me out of the bed, let's just say that. So a terrible, gas and pain. Right. And so that actually motivated me to, holy cow, I do have a gluten problem. And I coasted, and I went a full year without having any. And then I rechecked my blood work, and I actually healed my leaky gut. So if you have a cheat day and you have that problem, you're not all the way back at the beginning of it, is going to reverse you. So so it depends. There's
no way that you can heal your body. And put the toxins back in.
And that was just a small amount. So like, if the person does have a dairy issue and you're allowing them to have a little bit, they're gonna have a difficult time responding. So, but the only way to know whether you have the dairy issue, the inexpensive, the free way, is to eliminate and then challenge. Like, so I inadvertently challenged, and then I didn't want to do that anymore.
And you pay the price,
I
and
paid
you
it.
decide it's not worth it.
And I've had one patient do that, so because she, the blood work's very expensive, and she didn't want to go to a functional medicine doctor. Honestly, it is about $1,000 for good blood work to determine sensitivities. So she went 6 weeks with no dairy, no gluten, and then challenged with some bread, and I think she did fine, and then did like a glass of milk or something, and it was horrible. And so she stopped it, and her headaches was her problem, and they went away. So it depends on what the problem is. So it's a very convoluted topic.
Yeah, that is crazy.
But it's a good idea for everybody to limit small amounts like you're suggesting, so you won't develop the sensitivities in the first place.
Right.
So, but if they already have the sensitivities, it could be another issue.
Yeah, totally get rid of it. Yeah, that's amazing.
Okay.
It's something that we preach a lot, but coming from you, it's like, Daddy said it, because you're the doctor.
And having gone through the zero, now I'm doing exactly what you're doing occasionally. And so hopefully I'm not going to go over the board where I start developing those sensitivities.
Right, because when we have people go on the program and they've done well, and they have met their goals, I will tell them, once you have met your goals and you've kept those goals for at least 6 months, then you can kind of do the 80-20 lifestyle and kind of play with it. But sometimes people will like flip-flop and go 20-80, and then all the problems come back.
Right. And
so you really have to be like mindful of what are you putting in your mouth. And we talk about, the foods that you eat, they're either going to hurt you or heal you. It's either or, So
you would think, but it is human nature to either go all in or fall out the way. So that's the reason why. So if I ever develop those sensitivities again, I'm going to kick myself in the rear and then go through the whole year again.
And go through it all over again.
That's right.
Yeah. So let me ask you something else. What about superfoods? Have you ever thought about certain superfoods? Are there foods out there that actually help specifically with inflammation?
Well, and that's something you guys probably talk about all the time. The thing that your diet should be nutrient-dense foods. And so what I do is I try to eat a lot of green leaf vegetables and salads in general. And but I always, for years, I've done what's called a green drink. And so when I make a shake, I don't want to counteract what you're saying, but I will do coconut milk, which has medium chain fatty, and then I'll do blueberries, and I'll do chia seeds sometimes, but I'll do a scoop of a green drink, which has a bunch of different superfoods in it. So it's just really important. It's really like now I take hundreds of dollars of supplements a month, and vitamin D. And vitamin C is very good today, but vitamin C is made in a laboratory, so it's ascorbic acid. Now, vitamin C in nature is a little bit different in the sense that it has it's surrounded by these nutrients that we don't even have a hold of that work synergistically with it, and they give them the group term bioflavonoids. So now here's what resonated with me. Sailors back in the day would be eating fish, and they'd go months without any citrus fruits, and so they wouldn't have any vitamin C, and they developed scurvy.
Right.
So what they did, now if we gave those sailors back in the day vitamin C, they would still have scurvy. But what they did to counteract that was they just put a little bit of lime in their beer, and that little bit of lime was enough because it had not only ascorbic acid, but had all those bioflavonoids, and it prevented them from getting scurvy. And that's why we call sailors limeys, by the way. And so we haven't figured it all out, but nature always comes up with the best way. So that's why these superfoods are extremely important to incorporate. So that way we're getting the nutrients that we don't even realize that we need to get that work together with these vitamins. And so yes, I consistently take superfoods that include mushrooms and you like I said, I like when I do my drink a lot of times put blueberries, which are and I do kale, by the way, which is another superfood.
Yeah, absolutely.
So frozen kale, by the way, in a shake, if you did that. So you do it, you freeze it, and then you just put a few leaves in. When it blends, it'll actually.
And you can't even taste it.
You can't. Now you eat it on its own. It's
Yeah, that's different.
Yeah.
So for our superfoods, we will typically do MOA, which is a lot of superfoods. Has like 6 different mushrooms in there. Has black pepper, turmeric in there, so it's all kind of going together.
Yeah, and the turmeric, that's a supplement I take on its own. Exactly, that's a very good anti-inflammatory.
Really good.
So the mushrooms, just out of curiosity, it's like lion's mane and cordyceps. Those are fantastic.
Yep, those are all in
very,
there.
very, very good.
And so that's what we typically use. And then it's really hard to go to the grocery store and grab those out of the produce aisle, so it's all in one little pack, and you just.
I highly recommend that. I do that myself.
Yeah, that's a good one. So we love the superfoods too. So,
fantastic.
Yeah, that's it.
I think that's everything we wanted to cover.
I think it is. I appreciate your time. this
You're
to
very welcome.
me
Thank you
is
for that.
very helpful. And I've been doing this forever, but
And like I said, you're doing a very, very good job.
I have learned a lot from you today, and I appreciate that.
You're very welcome.
So I'm going to send people to you if you don't mind.
I appreciate it.
Okay. All right, guys. Until later, y'all make good choices.